The purpose of this orientation is to familiarize the preceptor with your roles and responsibilities in the education of the paramedic students. The education will also review the expectations you should have of the students and what expectations they have of you, along with reviewing an EMS program patient worksheet and explain how to complete the form correctly. When you have completed this orientation, please fill out the form at the provided link to complete your preceptor application. Also, for more in-depth information and direction on our program specifics, please refer to the provided link for the Field Internship Preceptor Guide. The objectives of this program are to explain what your roles and responsibilities are as a preceptor, what expectations you should have of the students and what expectations the students have of you. Your first job is to help the students remember what they have been taught in the classroom. If a student makes it to field internship, that means that they have demonstrated the knowledge base and skill set of an entry-level paramedic. The student must now apply what they have learned in the classroom and lab to real patients in real-life situations. This transition is harder and slower for some than it is for others. The best way to facilitate this experiential learning is to demonstrate great patient care in all its aspects. Please remember, you are not just teaching the science of medicine, but the art of patient care. You can have enjoyment and fun during the shift, but maintain a high degree of professionalism, model expected behaviors, have a positive attitude and be success-oriented with the students. The students must understand that they are in a safe learning environment. That means they can treat the patient, but you will not let the students harm the patient. You will constructively and appropriately correct them and you won't demean them. You must remember they are entry-level providers, not experts like you. Try to remember when you were in their position, and how scared and vulnerable you were. Guide and educate the students throughout the shift. Remember, the students can only correct their issues if they are constructively pointed out and remediation is given. Provide guidance and correction where needed. Praise them if they earned it. Please accurately and honestly document the student's performance on the EMS program patient worksheet. It is only through your complete and objective critique that the coordinators and instructors can evaluate if the student is worthy to pass the program. When you are filling out the forms, please have in the back of your mind, would I allow this paramedic to treat a member of my family? If the student does not deserve to pass, document that, but please document why. You are to play many roles in the education of the students: teacher, mentor, friend, counselor, coach and tutor. You are there to allow the students to think for themselves, while at the same time guide them in the right direction. As students become more confident, you should have to guide less and the students should act more and more independently. Learning is a change in behaviors. That is the acquisition of habits, knowledge and attitudes. It is both a product and an active process. Remember, it is a process, not an event. As a preceptor, just as you have certain responsibilities, you have the right to expect certain behaviors of the students. First and foremost, you have the right to expect the respect of the student. You are a practicing professional with years of experience, you have a right to expect the esteem you have earned. You also have the right to expect the student to have the knowledge and baseline skills of an entry-level paramedic. The student should demonstrate excellent EMT knowledge and skills along with all the fundamental knowledge expected of an assumed to graduate paramedic student. If these essential skills and knowledge are absent, you have the right to document the issues and send the student home. You have the right to expect the students to show up ready, willing and excited to learn. The student should not need prodding to check equipment or the vehicle. The student should be enthusiastic and ready for the learning environment. You should be prepared for questions. As discussed above, the student should be eager to learn. Part of the process is to ask questions about patients and situations. The student has the right to ask questions, but you have the right to answer these questions at the appropriate time. That time is not in front of the patient. Also, these questions are to be asked in a respectful manner, not as challenges to you or your knowledge. You have the right to accurately and honestly document the student's performance on the EMS program patient worksheet, good or bad. You are not just a field provider but a reporter of the student's performance and readiness to practice on their own. You should never feel pressured or threatened to evaluate a student's activities and skill set, in anything other than the objective truth. Just as you, the preceptor, have the right to certain expectations and behaviors, the student also has the right to expect certain behaviors from the preceptor. The student has the right to be treated with dignity and respect. Students should not be the subject of derision or mistreatment. You should not talk down to the student or demean them. They are there to learn and you should expect them to make mistakes. Please do not make fun if they do. Also, once a student leaves, please do not talk ill of them behind their back. If the students have issues that need correction, tell them. If the student has significant problems or is clinically unsafe, please notify the clinical coordinator. In addition to the basic rights of decency, students have a legal right to confidentiality of their learning experience. The student also has the right to expect you to have the knowledge and baseline skills of an experienced paramedic, and that you will safely guide their care of the patient. Just as you have the right to expect the student to show up ready, willing and excited to learn, the student has the right to expect that you are ready and willing to teach. The preceptor should be enthusiastic and ready for the learning environment. The student has the right to expect accurate and honest documentation of their performance on the EMS program patient worksheet, good or bad. You should be an objective reporter of the student's performance and readiness to practice on their own as an entry-level paramedic. The student should not be subjected to unsafe, unfair, or inappropriate situations. While it is not always possible to control situations, please remember the student is just that, a student. This is the EMS program patient worksheet. This form should be filled out for every shift. The EMS program patient worksheet serves as the overall log for the shift or day's clinical activity. This worksheet is used to document and evaluate the paramedic student's performance as a team member as soon as possible after a patient contact. Directions for completing the evaluation are found at the top. At the conclusion of each patient encounter, the student should first evaluate his or her performance on the EMS program patient worksheet, followed by the preceptor's evaluation of his or her performance. This will allow the preceptor to assess the accuracy of the student's self-evaluation prior to providing constructive feedback regarding the process of self-evaluation. Every patient interaction should be evaluated. The student should mark their self-evaluation ratings in the row labeled S. The preceptor should document their rating of the student in the row marked P. This is page 2 of the form. Here the preceptor can make any comments they deem appropriate about the student and how the shift went. The preceptor can also give the student areas for improvement for the next shifts. This section is to document student behavior in regard to professionalism. The preceptor should note that both the student and the preceptor must sign this section. This last section explains the clinical objectives and the grading system. More complete instructions on this form and how to complete it are available in the Field Internship Preceptor Guide. On behalf of the Davidson-Davie Community College EMS program, we would like to personally thank you for working with our paramedic students to help assure their competency as entry-level paramedics. Without your dedication to the profession and our students, we could not have the quality paramedic program that students and employers have come to expect. If you have any questions or concerns, please contact our EMS Clinical Coordinator Joseph Wilson.